Okay, so it's 2 minutes past one. So we'll just kick off now. So welcome to this Masters in Public Health at Imperial webinar. I'm Anthony Laverty, Senior Lecturer in Public Health here at Imperial, and one of the co-directors. So this whole webinar is scheduled for an hour. So we've got some slides we're going to go through to sort of go through key aspects of the course, introduce ourselves. We are taking questions on the chat, so if people have any, you can put them in there, and we will answer those. And also, there's a bit of time for questions at the end. I am personally only going to be here for this very first bit, but then after that, uh, Joe, the team, Henok, Zainab will be around for other questions. Do you mind going to the next slide, please, Zainab? Um, oh, perfect. And this is, so this is where we're going for the next sort of 40 minutes to an hour. So I'm going to do this introduction, and then Henok is going to talk about the course overview, the content, and Zainab's going to talk about dissertations, which we're in the process of having students go through the choosing of that for this year, and then careers, and then Q&A. And do you mind going to the next slide, please? Zainab, thanks. So these are some, so Joe says in the chat, so if you have any questions, please do put them on there. So got a few slides on the course team, so people know who you will see sort of throughout the process. We've got Professor Azim Majid. He's head of the Department of Primary Care and Public Health here at Imperial, and so he's the course chair, has a sort of oversight role in terms of what we've got in the course, and is very helpful behind the scenes, and you'll see him a little bit. We've got sort of going right to left, we've got Zainab, so senior teaching fellow and course organizer. So you'll see a lot of Zainab, and she sort of shepherds you through through the whole year if you come and join. And then there's Henok and I, and so Henok and Zainab maybe introduce themselves when they sort of get to their respective parts. But so just, I mean, a tiny bit about me is that so I joined Imperial 15 years ago. So I've been here for quite a long time. And so I joined as a research assistant, sort of reasonably fresh out of master's level education, worked for a little bit, joined Imperial, sort of did my PhD here, and sort of stayed in various roles. When I'm when I am teaching, sort of teach a module called population health improvement, really around, what are these, what are the big things to think about when trying to improve population health, and also a relatively new module with Henok around the commercial determinants of health. What are big companies doing that are impacting health in different ways? Outside of that, I've got a sort of range of research interests. Big interest in tobacco control. What can we do about the 8 million deaths caused by tobacco every year? It is today the 20th anniversary of the WHO World Health Organization Framework Convention on Tobacco Controls, and we know that that continues to be a big struggle in public health, and also some other research interests around the sort of impacts of transport and health. So that is a bit about me. Do you mind going to the next slide, please, Zainab? And so this is the course team. So Joe, again, you'll get a lot of emails from Joe, maybe even see her in person sometimes. She's behind the scenes making everything work smoothly with Sylvia and Lauren, and also crucially, Joe is in the chat right now responding to your questions. So keeping everything going. And then the next slide, please, Zainab, is and so I guess we've made this three-part distinction here. This is sort of the course organizing team. There's the administration team keeping everything going. But, obviously it is a whole year of your life. It will be a great year, lots of great things happening. Move to London, unless you already live here. But, there can be issues, things come up in people's live. So this is our support team. So we've got Jenny Husbands, manages student welfare. We've got Sundus Hasuna, who is our professional skills support lead. So she talks a lot to students about sort of careers, where are people going, where do they want to go, how does the course fit into that. And then also Wendy Kwok is our academic skills support lead. So she is on hand for sort of academic questions around, how do I write an essay? What is a good way to study for my exam? So you've got various people that you will see throughout the journey. Do you go to the next slide, please, Zainab? And then so just I mean, the next sort of few minutes is the sort of the where, the why Imperial section. Why should you come to Imperial? I mean, one thing, as I've mentioned, I joined 15 years ago, so I've got some, I guess, belief in the power of Imperial as being a place to stay for, almost all of my working career so far. But the Imperial School of Public Health is, at the cutting edge of public health research. So, people are presumably reasonably aware of us. You've come to this webinar, but sort of, consistently rated among the highest in the world in terms of research quality, student experience, excellence in terms of careers and where people go on. Every sort of 8 years, 7 or 8 years, the UK has a system where they rank and rate essentially the quality of research across different institutions. And so the last time they did that was in 2021. And so the decision there was that Imperial had the greatest proportion of world leading research of any UK university, specifically in public health. And so, really doing our bit to advance both the science and the practice of public health, both in the UK and globally. Go to the next slide, please, Zainab. And so this slide, talks a little bit more about these ref results and what a great job essentially Imperial did. And then you go to the next slide, please, Zainab. And sort of more recently, outside of these big behemoth exercises of ranking research and the outputs from our academics and researchers, Imperial's first in the UK and Europe and second in the world in the QS university rankings. You can look at different rankings. Imperial consistently comes out very highly in them. 2023, the Guardian University of the Year. 2024, top university for graduate employment in the Sunday Times Good University Guide. And then just the last slide from me is to sort of I mean, maybe this all seems a little opaque, but just to sort of, to give a flavor of some recent research we have produced or has been produced by people at Imperial. So I just went through the Imperial School of Public Health News website and just clipped a few things, which sort of piqued my interest and sort of try to give a sense of the range of things we're have been working on, and we've got teams working on. Lord Mayor of London event around what are the solutions for global health and well-being, trying to get researchers, academics, students and policymakers together. You had the Mayor of Freetown giving a talk around urban resilience, climate adaptation. What can we do with what we know is forecast to sort of happen to urban areas. What are the solutions and what can we do in terms of adaptation and mitigation? Lots of global work with lots of big databases have been collated at Imperial. And so lots of different issues there. Food allergy, that has been doubling. That has doubled in the last decade or so in the UK, but still lots of people without treatment for that. Again, related to nutrition. The groups at Imperial have really pioneered this concept of ultra processed food research along with colleagues in Brazil. And so, big epidemiological studies around, how does that relate to cardiovascular disease and other types of disease. A little event, we had an event about teaching, teaching tools. How can we use AI in teaching? It's obviously very relevant to lots of people, and also how can AI be used in health checks, the double burden of malnutrition in Peru. And so people are not familiar, the double burden of malnutrition is where, sometimes even in the same household, you can have people who are overnourished, overweight, and obese, but also people who are undernourished. And so, how can we deal with this inequality and these issues which are evolving over time? Soaring childhood obesity, we certainly see in the UK, and lots of issues, and big work on Imperial around what to do about that. Lots of COVID modeling, lots of infectious disease modeling, and also lots of working with governments to both, pinpoint the issues, what are the health consequences of COVID, and what can we do to deal with them. And then finally, some more modeling work around malaria vaccines and what impacts we would see from those. So this hopefully gives you a flavor of the research that is going on at Imperial. I'm going to hand you over to Henok and Zainab and the rest of the team, and I'm going to have to nip off, unfortunately, but hope to see some applications from you, and hope to see some of you come October. Thanks, everyone.
Great. Thank you so much, Anthony, and really delighted to have you all here with us. As Anthony said, my name is Henok Tadesse. I'm a principal teaching fellow / senior lecturer in public health. So I joined Imperial about 10 years ago, and I joined and have been working on the Master of Public Health course ever since. And I can tell you that the course has really grown in so many ways over the last 10 years. Our student numbers and the interest from across the world has really increased over this time. To the point where we're having to put up waiting lists for those who might apply around the end. So if you're really thinking of applying to the course, we strongly advise that you put in your applications as soon as possible. So even today, some of you might have already applied, might have already had an offer, or some of you are contemplating to apply. So what I'll try to do is give you a glimpse of what your year with us will look at, like in terms of between Zaina and myself, we'll try to cover the whole year in terms of what your engagement in the School of Public Health will look like. But first, just to distinguish our course from our sister course, which is the online Master of Public Health course, which allows you to, there's this fully online course. The course content is virtually the same. It's the same teaching teams who are teaching the online. I teach on the online. I teach on the on-campus as well. So I lead the research methods. I call it the research methods module on campus, and I call it the research portfolio. We call it on the online. And as Anthony said, we run this policy-related module looking at commercial determinants of health and health policy. But yeah, so basically, virtually the same course, but tailored to people who might want to do the course online. And that allows you to apply at different levels. So you could apply for just a PG cert, a PG dip, or the master's degree. With us, if you come to the on-campus one, you cannot apply for a PG cert or a PG dip. You have to apply committed for the full master's. And if you very rarely it happens, very rarely, for so many reasons, students can't complete the whole course. After they have come, we do offer them the exit awards on the on-campus, but you can't apply for the PG cert or the PG dip when you come for the on-campus Master of Public Health course, which is the course that we are speaking about today. But just to let you know that there is this sister course, you can go and have a look at it online. And we've got another slide highlighting the key differences, right? So the online one is a fully online course, and you could do it the full master's program. You could do over 2 years or 3 years, but you could also decide just to have a look at it first and enter at the PG cert level, PG certificate, and then or the PG diploma. After you've joined on those levels, you could also decide to continue on and complete your master. So there's some flexibilities around how you join, but for the full information, I would advise that you go and look at the relevant links which are provided here. Next slide, please, Zainab. So in terms of our course, we're talking about the fully on-campus, in-person, one-year intensive course in London at the School of Public Health's new, flashy, really nice building in White City. But in terms of our course structure, we have what we call the blended delivery approach, which is proven to be very effective pedagogically. We've worked on this over the years, where we've basically curated a series of online materials, online lectures, resources that we expect our students to complete some amount of work on those things before coming to class. So if you look at research methods, for instance, if I talk about my own module in the first term, we start classes around 11 a.m. to allow you to complete the online materials, the basics of what we're going to speak about on the day. You come to class, and in the classroom, it's more interactive sessions than us just talking at you throughout the lecture. And we do things like we assign research papers, we ask you to read them. If we are doing mixed method study that day, we give you an example of a mixed method paper, you read that, we come to class and we critique that paper together. So it's that kind of approach that we have developed over the year across all modules, I'd say, almost all modules. And then at the end, we have a 4 months fully dedicated from May until August, fully dedicated to the research project, which Zainab is going to speak about later on. So the objectives, really the principles around our approach are: one, public health is a very wide, broad church type of discipline that incorporates a lot of other disciplinary perspectives: health promotion, health protection, health behavior, health policy, health economics, financing policy, politics, sociology, and other things, and the biomedical sciences, of course. So we want to make sure that we are very comprehensive across the year, and I'll show you shortly how we try to incorporate those and cater to the varied interests of our students when I show you our course content. And also, the key principles and methods of public health. So we've got in the first term the foundations of public health practice module that really addresses the key principles around health protection, health intelligence, and other things. But also the focus on our course is analytical skills, especially the quantitative analytical skills. So you've looked at Imperial, its persuasion, its expertise, all the things that Anthony has spoken about. So we will give you really good understanding of the fundamentals of epidemiology, biostatistics, and research methodology. We do cover qualitative methods, mixed methods as well, and it doesn't mean that if you've joined us, you have to complete your dissertation only using quantitative methods. You could do it through systematic reviews. You could do it through qualitative research or mixed method research, but we make sure that you've got the fundamentals of the analytical approaches. And finally, we try and foster a creative and supportive learning environment. That's why a lot of our teaching sessions are not just spoon feeding students and lecturing every day. It's mostly around deploying innovative practices to engage students in creative critical thinking and interactive sessions throughout our teaching modalities. And looking at the course structure, so this boils down to first term, you've got 4 modules that you undertake over 10 weeks. These are our intensive, compulsory, and core modules. The second term, we offer you an array of choices of modules. So over the second term, each student would complete 6 modules. Out of these 6 modules, 1 is compulsory, which is health economics. Everybody loves it. It's over at the business school, but also because we feel it's very much differentiated from everything else that we offer, that actually runs over, that's the only module that runs over the 10 weeks. The rest are short 5-week modules, 5 of them, which are elective. So you can mix and choose as you like, and I'll show that to you in a moment. And then, as I said, from May until end of August, this is completely dedicated to the research project. One thing to point out is we don't have placements or practical engagements during that time. We dedicate all of the time. There's huge emphasis on the research skills about you completing your independent project, and that's complete. That's what the 4 months are wholly dedicated to. Next slide, please, Zaina. Right, so this will be your first term. So on Monday you come in, should actually be statistical thinking and data analysis on Monday. Tuesdays, the whole day, it's principles and methods of epidemiology, and our classes are scheduled over the day, right? So it's not like you have epidemiology and then you have statistics on the same day. It's like your Tuesdays are completely dedicated to epidemiology. And the way we teach it, as I said earlier, is you start off actually by completing your homeworks from last week through tutorials, and then there's a bit of lecture style front teaching session, and then you go off to tutorials to work with assigned tutors to assimilate the concepts that are taught over that day, and that applies to all our other modules, but these are the core topics. So epidemiology is core, statistics is compulsory, everyone has to do all these 4 modules. Research methods is compulsory, foundations of public health practice is also core. So these are your 5-week between October and end of December it would be scheduled like this, and your Wednesday is some other seminars and college-wide activities that you would engage in. And going to the second term, right? So this busy slide shows you that we have, I think, around 20 modules for you to choose from. And we've curated this over the years. Like I said, public health is quite a broad discipline, and we want to incorporate different aspects of it. So, for example, quality improvement in healthcare for those with that persuasion and interest. Environmental epidemiology, which is a different field within public health. Participatory approaches in public health. Like I said, health economics is the only module that's compulsory to everyone, and it runs actually over the whole 10 weeks. But I should also mention, and you might have already seen this, so we've got around 6 streams for you to choose from, right? So you can define your stream or concentration within this second term, right? Now, currently, the choice has been that, okay, let me just to kind of paint the student journey. Each student will have 6 choices over this, 6 modules to take in the second term. One of them is health economics, which is mandatory. Then you've got 5 choices left. Out of these 5 choices, now, up to now, it used to be just 2 of them should be stream defining. If you've chosen, say, for instance, quantitative methods stream, up to now, you could only choose, you could choose 2 of the modules which are designated under quantitative method stream, and you would qualify for that stream. Now we're changing that from next year because of student feedback from our experiences, students want this to mean much more. So to add more gravitas to the stream choices, we are actually saying you have to choose 3 modules that are categorized within that stream to qualify for that stream. And then you're left with 2 modules more to choose from other streams, other designated streams. Or you could say, I'm not interested in the whole stream business. I just want an MPH and I'll mix and match my module choices as I want. That's not a very popular choice, but a few students do that every year. So all that choices would be available to you over the second term. Next slide, please, Zainab. Thank you. So this is the third term which Zainab will speak to you about. But just before that, in terms of assessments as well, it's not just essays that you have to write about. We have a combination, a mix of innovative, what we call in pedagogy, authentic assessment. So you'd be doing the academic essays, and these are not just general academic essays. For instance, in Zainab's Global Health Challenges module, you do this commentary that you would normally write to academic journals at the end of your module. There are what we call, one module has this elevator pitch. How do you, around innovation, how do you get your innovative ideas across to a decision maker within a compacted amount of time? We have video vlogs that you have to submit. Simulations in outbreak assessments, reflective statement, and so forth. So, but also, it's not just summative assessments. We have a mix of formative assessments that would enable you to get better prepared for your summative assessment. And all these assessment dates and descriptions will be included in your module handbooks. And we also have a course assessment schedule so that you can be better organized and anticipate your assessments as you work through your year with us. And we have introduced recently what we call the academic support and guidance small groups. So I am working with about 9 students through that mechanism. We meet once or twice a term, and we discuss about any challenges that students are facing academically, any resources that I can share that they can share with each other and strategize. And that's been really interesting and very useful. And a number of our academic support group tutors are actually alumni of our course who are currently employed and working with and working with. I don't think we have any of our PhD students or alums involved in that. I think it's all people who are working at an academic level, but who, so the majority are ex-students, which helps with that conversation as well. So in terms of extracurricular engagements, Anthony has already outlined, we have the student support group and the academic support through Dr. Wendy Kwok, and she would address different aspects that would help and aid your academic readiness. Seminars around critical thinking, and working through academic feedback and how to avoid academic misconduct. We take very seriously any alleged plagiarism, for instance, or unauthorized AI use. So we cover a lot of this in your induction week and occasionally through seminars, so that you're also getting this extracurricular support. And we have career support through what's organized through Dr. Sondus Hasuna. So periodic career sessions where ex-students, alumni who are working in different industry come back and speak to you and providing further guidance. But also, just to say, there's this Imperial graduate school seminars and workshops and other opportunities across the college that will be available to you. So there's actually so much going on. And what we advise across the college, within our department, there are departmental seminars which are open to students. There are these Christmas talks and other occasional talks that bring in authoritative figures to give this one-off talks that the college community comes together in, and those all will be available to you. And we advise students to be organized in their and anticipate these times and then make use of all those opportunities. Next slide, please, Zaina. And I think finally for me, talking about, you might have already seen this, our popular WHO annual visit that happens in June. So we organize, we have Imperial hosts one of the WHO collaborative centers in the world. Professor Salman Rawaf, who you see at the bottom, is the director of that center. They organized this visit to WHO. And the gentleman on the top right quadrant is Dr. David Navarro, who is this high-level WHO advisor who got to speak to our students on one of these years. So it's organized over 3 years. You go to Geneva. It's not just a visit to WHO, but other international agencies. It's highly, highly appreciated by students. Unfortunately, we cannot take all students on this course, just to give a disclaimer. But you know, about 35 students will get the opportunity to go. It's all fairly decided in terms of who goes. But also what we have done since recently has been to open up the opportunity through all the seminars that happen during that visit are also transmitted over Zoom virtually. So the students who don't get to go, but not just the students on the AIM page, but the students on the other courses on at SPH also get the opportunity to participate. So this also includes the career support sessions, the orientations around how to land an internship at WHO, how to land a job at WHO and the other agencies. All those will be covered through intensive programs over 3 years, so that those who get the opportunity to go and want to pay the travel, it's subsidized to a minimum level by the school, but you have to pay that extra bit, and the students who choose to do so, they would get the opportunity to go. Next slide. I think it's over to Zainab. Thanks so much, Zainab.
Thank you, Henna. Hi, everyone. Lucky to have you on the webinar. So I'm Zainab, and as Anthony said, I'm the course organizer. I'm also a senior teaching fellow in public health and a nutritional epidemiologist by training. So I lead the nutritional epidemiology module. I also co-lead the global health challenges module. But another key thing I do is help with the organization of the research project. So I'll talk you through that. So the whole course really from the start prepares you for eventually carrying out your independent research project. So in term 1, on your research methods module, you'll really focus on developing a research question and starting to think about the process of doing your own research project. So there are students who take forward the research question that they develop in their research methods module and develop it into their own project. But in term 2, really, that's when we really start you on the process of selecting a project. So we do encourage you to develop your own project. And if you want to do that, the course team can help you develop your ideas and put you in touch with potential supervisors every year. We have more and more students doing that. But if you don't want to develop your own project, we release from across the school. So academics from across the school, School of Public Health, will submit projects, and we released a selection, a really big selection to you. And then you can select 3 choices, and then supervisors will interview students based on their CV or a paragraph that they ask them to submit, or they might interview you. And then so you secure a project through that process. We have a first round, and then whoever doesn't secure a project in that first round can then go through a second round. So this happens in term 2. So by the end of April, mid-April, really, everyone has a project so that they can start and the 1st of May is the official start day, but quite often if students don't have so many modules in the second half of term 2, or they've finished all their assessments, they can start beforehand as well. So once you've selected a project, and I'll go through some examples of different topics and different methodologies in a bit. Once you start the project, it's a really well supported 4-month project, though it's your independent research project. And quite often you'll be embedded within a research group, and all projects have 2 supervisors. One can be external, but one has to be within the School of Public Health, and most projects have both supervisors within the School of Public Health. So it's meant to be an independent research project and also an authentic experience of actually doing real life research. So once you've worked on it for a few weeks, we have a check-in presentation from you in early June, which is assessed, which is 10% of your total project mark. And then that's really to check that you've developed a research question, you're on the right track, you're not just left to your own devices, and make sure you've got aims, objectives, and your methodology outlined. It doesn't have to be that well developed at this point, but we do need to see that you're on the right track. After the check-in presentation, you'll carry on with either your data collection, your data analysis, and we'll have regular meetings with your supervisors. So most supervisors will meet their students at least every other week. And we have a series of summer taught sessions to support you, depending on what methodology you're doing. You attend different ones, but there are some that everyone has to attend, such as how to conduct a literature review, how to present your results, ones like that. So once you've done the bulk of your work, you'll write up in early August, and your supervisors would give you at least 1 round of feedback on your draft. And then in August, you'll submit your written dissertation, which is a 10,000-word written dissertation. And then 2 weeks after this, you'll have a presentation viva, where 2 members of staff that are not your supervisors will listen to you present your project and ask you questions on it. So that will be the final assessment of the course, is the viva. And let's just go through some example of past projects so you have an idea of the kind of projects that students have done. As Henrik said, these are in a really big, wide range of appropriate methodologies that are done in the real world. So there could be systematic reviews or scoping reviews, primary data collection, or data analysis. So there's a lot of databases and data sets that staff across the School of Public Health have access to, and you would have access to this data and do some data analysis with it. There's also a really wide variety of topics that are covered, which reflects the wide variety of research groups across the School of Public Health. So if you go on the School of Public Health website, you can see all the different departments and all the many different research groups that are there. And it's possible to do research in any of these research groups. You can initiate and develop your own research project, but it's likely that most of these research groups will submit a research project. So you can see there's some here on the impact of the food environment and obesity, on ones on health innovation, ones on tobacco control policies, quite a few on diet and lifestyle and physical activity, since there's a lot of expertise on that within the School of Public Health. There's a lot of expertise on tobacco as well as COVID-19. There's a lot on cognition and aging. We have an aging epidemiology unit. We have a really great environmental epidemiology unit. So all of this is reflected in the kinds of projects that are offered to you. We have a lot of research on chronic diseases as well, so a lot of projects on chronic diseases. So hopefully that gives you a flavour of the range of and type of projects that would be available for you to do. And then a lot of students develop their projects into publications as well. So this is some of the previous projects that have been developed into projects. So this one is about access to primary care and visits to emergency departments, and it was a cross-sectional study of a secondary data set. And then this one in the European Journal of Epidemiology was on blood pressure, hypertension, and the risk of sudden cardiac death. So this was a systematic review and a meta-analysis of cohort studies. And we always get some really good projects from this group. And then this is another systematic review, which was about community-based interventions for improving mental health in refugee children and adolescents in high-income countries. So I think this one was one of Henek's projects. And then in this one, in the Journal of Adolescent Health, again on exposure to tobacco and e-cigarette use, and it was an analysis of survey data. And then we've got one, a qualitative project looking at male involvement in reproductive, maternal, newborn child health, looking at gaps between policy and practice in Uganda, another one of Henek's projects. So that's the projects. And as I say, you're welcome to, from the start of the course, really start talking to us about any topic ideas or research project ideas that you're interested in. We're very happy to support you in the development of your own research. Now, moving on to the career destinations, there's really such a big range of roles and employers that students go on to, since MPH is such a wide field. So we also have quite a lot of physicians, quite a lot of clinicians on the course. So they often go back into being a clinician. Hence, you can see that 11% go on to be a physician. There's quite a few that go on to be a research fellow or a research assistant, and then public health registrars, analysts, lecturers, management, consultancy, and a really wide range of employers as well. So there's the NHS, the Department of Health, non-government organizations, higher education. So these are some of the roles. If you look on LinkedIn and type in MPH Imperial, you'll see that these are just some of the roles that come up. And here's some more examples. So we've got in industry as well. There's a lot of MPH graduates working in industry across the world. And then we've got a lot of graduates in academia. I think at Imperial alone, we've got a lot of MPH Imperial graduates. As Henek was saying, some of them are academic support group tutors. We try and really keep in touch with our alumni as well. And then various government public health organisations in the UK, such as the NIHR, UKHSA, which is the Health Security Agency, and then various local authority and public health departments, Department of Health and Social Care. For example, we've got one person who's an infectious disease modeler at the UKHSA. And there's quite a few, we have quite a few projects that are linked with local authority as well. So, and we've got a lot of students that go on to do PhDs, which they do through their links, through their research project. So the research project is really also an opportunity to network and develop links for your career development. And then finally, we've got quite a few MPH graduates working at various non-government organisations and think tanks such as Policy Connect and the World Obesity Federation. And as Henek said, Dr. Saunders Haswina, who's our professional skills lead, organises some fantastic career seminars throughout the year. There's a PhD information session that they organise in year one as well. And this is done in collaboration with a student forum. So at the start of your course, we select the student forum members, or you can put yourself forward to be a student rep or a student forum member and contribute to organising these careers events as well. So there's really a lot of career support available through the graduate school. They have a professional development program with lots of courses, which is fantastic. So there's no shortage of things that you can look up or courses that you can do. There's careers fairs, there's one-to-one appointments with the career service. So there's a lot on offer. It's just a case of, and there's really well signposted by our professional skills lead, Dr. Saunders. But also, if you just go to the career service website or the graduate school website, there's really so much on offer that you can take advantage of it in your time here. This is an example of some of the things that the career service offers. So as I said, one-to-one appointments, PhD application support, careers fairs, and employer events. There's also these really great attribution and aspirations courses that they offer that really help you develop the academic skills. As you can imagine, at Imperial, it's a really high level of academic skills required. So these courses can be quite useful as well to manage that. And there's just some book suggestions that you might want to read before you join the course. So I think that's it from us. You can have more of a look at the website and email any queries that you have, and also have a look at the School of Public Health website to have a look at the faculty that will be teaching you, the research groups that are active across the School of Public Health.
Great, thanks very much, Zainab. And yeah, we're happy to answer any questions you might have. Yeah, we've been answering your questions in the Q&A through chats, but if you put them in the Q&A, we can pick them up and answer here itself. Okay, this is a great question, Alexandra. How do we make our application stand out? You've seen the basic requirements on the web pages, at least a UK equivalent 2-1 degree, and everything else, which are the core, the English requirement, which are immutable, right? You have to meet those basic requirements. But beyond that, say, I was answering one of the questions in the chat, if you haven't completed your undergraduate degree, you'd need to show that you've been really interested in public health or epidemiology fields and have been doing some internships, placements in the healthcare sector, and things to that effect. And I can't emphasize enough how important your statement of purpose is. We don't want this, we want to know you, an honest reflection of your journey, and not something that's generic, something, how you would make use of the course and your degree, and how you see your career progression, linking it back to your undergraduate degree, your qualifications and your work experiences, your exposures, experiences, all those things. So we look at your application in totality, and those things could really enable you to stand out. If you've got solid experience of a few years in research, in practice in public health, that would be a huge plus as well. Mahad, this is related to what I've just answered, what qualities we look for in our students. One, a good first degree, right? So well-performing students, at least above a 2-1, and who are able to link. So as we said, we accept from different disciplines, but who are able to link their interests in our course in public health with their background. So you could come from, say, a social science, sociology background, but have been looking at, say, through your undergraduate dissertation, through some of your coursework in your undergraduate and some of your extracurricular engagements, that you've had this demonstrable interest in a public health topic that is seen quite favorably when the panel reviews applications. In terms of the sponsor letter, I think, Joe, you might be well placed to answer that. But I think that should be standard. If you've identified a sponsor and they can guarantee your payment, I think that should be straightforward. And once you send the sponsorship, that's usually dealt with that by registry and not us, but that should be quite straightforward, I'd say. I think Josh answered these questions. We are looking at a cohort size of 85 around their students this year. But that means that 85 of you will be in the same class over the first term. Over the second term, you're going to all the 20, I think it's 21, 22 modules that students will be choosing and going to different classes. But that's kind of what we are aiming for. We kind of overshot this year, and we had slightly over 100 students in the class, and we had a long waiting list on top of that, but we're trying to regulate so that we limit it to 85 around there this year. Zainab, do you want to pick out that question? What are the international organizations that students can work in after this degree? And does Imperial have partnerships which allow the students to get a career there?
Yeah, so there's a really wide range, like I said in the slides, with students working in various industry organizations globally. A lot of them go back, international students that can't often get roles with the organization that they were in to begin with, and that they took a break from to come and do the masters. So it could be, you know, WHO, UN, but also smaller departments of health, NGOs, the health departments, local authorities. So really, really wide range of organizations, really, including organizations like PricewaterhouseCoopers, Deloitte. Yeah.
Yeah, so the consultancy firms and things, you know, so the one thing, like I said earlier, there isn't a chunky placement opportunity over this intensive 1 year. We dedicate, you know, the dissertation period into a high quality, a really high quality dissertation that you will have to produce as an independent researcher supported by 2 Imperial academics. We make available over 100 projects to our students every year from Imperial's own research portfolio. So all academics at the School of Public Health are actually required to produce project ideas, give access to databases, and support students in completing this really, really important piece of research that you complete. So that's where everything culminates, everything that we've been taught in over the years. So you know, I think that's the distinguishing factor. I'm sure you're looking at other courses. Have a look at the course structures throughout, and you will notice that we dedicate this significant amount of time, 4 months, to production of this research. A number of our students go on to publish in high impact factor journals at the end of that. And we have this incredible, fantastic, you know, appraisal of our students when they get to, and then one of the distinguishing factors is that there's a viva at the end of it. So you'll have to present that to a panel of experts at the end, and our external examiners are always provide high praise for what the students get to do over those 4 months. So our focus is on the research skills. But yeah, so throughout the year, there's the career support and people from these international organizations, industry, the consultancies, our own students who are working with these institutions come and speak to you. Some of them are live abroad, and they would link in over Zoom and do some sessions. So I think the specialization question is what we call stream, right? So there's some terminology between the online and the on-campus. With the on-campus, we've got modules. They call them specializations on the online. So make sure you're looking at our webpage. With our webpage, we've got modules and then streams, which are specific concentrations of specific modules that qualify you to particular streams. So with the streams, it's just a concentration. If you want to really go into you know, quantitative work after your aim page, you choose the quantitative stream, which ensures that you've done the 3 main quantitative modules. It could be nutritional epidemiology, which is Zainab's module, or environmental epidemiology, or advanced statistics, or infectious disease modeling. But you still have 2 more modules to choose from the other stream, so that you have this broader view of different disciplines and fields within public health. Health insurance with a UK university. Okay, Joe is answering that question, and I think she's better placed than me, so I'll stop answering that here. Yes, so in terms of undertaking your dissertation topic, a number of other departments like the engineering, business could also give us projects, so we make that available to students. But also you could also link up. We encourage students from day one to look for opportunities for a research and carve out their own proposals. Quite a few of our students do that, and they can involve other academics from other departments within Imperial, or even externally. If you've worked under placement in another research institution globally within the UK, you could elect to involve them as one of your supervisors, and we will assign one academic from the School of Public Health, but that's also very possible. Collaborative research projects. So we've got a rolling deadline, but we do encourage you to submit as soon as possible, because last year we had a long, very, very long waiting list, and we could not accept all our students. So I'd estimate, from April it can get quite start to get quite full. So I would say if you're decided to apply, get your applications nice and early.
There's a question about doing the course with a toddler at home. Yeah, it is quite a demanding course. It's intense and with quite a lot of pre-work to do beforehand. So you'd have to sort of factor that in. But we do give you time. It's not like you're on campus the whole day. Most modules will have maybe 4 hours of contact time during the day. Some varies by module, so you have some time. So if you think of it as a 8-hour working day, you'd have to factor in the time to do the pre-work. I'm sure with some organization it's possible.
Yeah, totally. But just to say, we've got one student who has caring responsibilities for her children on campus, and she's getting on very well. But as Zainab said, it's quite intensive. But we are very accessible. We are very friendly. As soon as you arrive, if you have this additional needs, get in touch, and we'll make sure that we provide all the advice and any accommodation in those respects that we can extend. So Michael, that's a specific question. If I think the turnaround is about 2 to 3 weeks for applications. We review, the panels decide if there are additional ththings to inquire. They will set up an interview, but you should hear from us soon. And if we haven't got back to you, you're not required to do anything else, and basically sit tight and wait for the outcome. And good luck.
Yeah, I think we are at time.
Yeah. I think Joy is answering the last questions. Okay. So we've already answered that question, and Joy is answering which is much better place to answer. I don't quite understand that question. Let's answer the last couple of questions. How would a student need to work with being able to find a place to live in London before the course starts? if this is about working whilst you're on the course, it's your statutory right as an international student to work up to 20 hours per week. But we also kind of highlight to students that our course is highly, highly demanding. And we wouldn't, I think 20 hours would be at the very, very higher end. We know students need to work to supplement some of their income, but at least we advise you not to have any commitments until you've started the course and appreciated the workload and the commitments required. But once you've done that, to some level, you could engage in some work. I don't know if I've understood the question well. Great. Okay, this is a final question that we're going to take. So Imperial has some postgraduate accommodation, but not a lot. And the student services should be, and if you're an international student, there's an office for international students. They have plenty of information around these things. But you would have to sort out your accommodation if you're not going to go for the postgraduate student accommodation. Imperial's own accommodation, you'd have to find your own accommodation in London. Great. I think that brings us to the end. Thank you very much, all of you, for joining us. We hope to see some of you in October. We really look forward to that. If you have further questions, please email mphqueries@imperial.ac.uk, and we'll be happy to answer further questions. For those of you who have already applied, you should hear from us very soon. We are continually reviewing the panelists meeting continually to make decisions on applications. Best of luck to all of you, and thank you very much. Thank you, Zainab. Thank you, Joe.